Hello, my name is April Hughes, and today I'll be presenting on the abuse of kratom in the United States. Kratom is a substance that's gained significant attention in the recent years due to increasing rates of usage, self-medication, dependence, and overdose risk. In this presentation, I will explain to you what kratom is, its history, patterns of use, associated risk, and the evidence-based treatment approaches. Kratom is a herbal substance derived from the leaves of Mitragona specia leaves. Sorry, I'm not a tree expert, but that is native to Southeast Asia. At low doses, it acts as a stimulant, which can increase alertness and energy. At higher doses, though, it acts more like an opioid, producing analgesia, sedation, and euphoria. In the United States, it's most commonly sold as powder, capsule, or concentrated extract in smoke shops, and you can also buy it online. Many individuals use kratom to manage pain, anxiety, or opiate withdrawal, although it's not FDA approved for any of those uses. I see them in tobacco shops. They'll have it advertised, and I've seen the detox of it. So kratom has been being used for centuries in Thailand, Malaysia, and other Southeast Asian countries traditionally. Laborers will use it they would chew on the fresh leaves to reduce fatigue and increase productivity during long shifts. It's also been used in folk medicine for pain relief and diarrhea. In the early 2000s, kratom entered Western markets where it began to be promoted online as a natural and safe self-treatment alternative, which has contributed to its increasing popularity. Current estimates suggest that over 2 million people in the United States use kratom. Many individuals report using kratom for chronic pain or mental health symptoms such as anxiety or depression. Emergency department visits and poison control center calls related to kratom have steadily increased, especially when combined with other sedatives, opiates, and alcohol. Like I said, I've personally seen it whenever I worked at a drug and alcohol rehab facility. We would have people coming there just to detox off kratom, specifically ones that were using it for that opioid-like effect that had been previously in substance abuse with opioids. So kratom contains 2 primary active compounds. I'm not even going to try to pronounce those two. These compounds act as a partial agonist at the opioid receptors in the brain, the same receptors targeted by opioids, which can explain why kratom reduces pain and produces that euphoric effect, but it also carries a risk for tolerance, dependence, and withdrawal. The individuals that would be most at risk for kratom misuse includes those with chronic pain or prior opioid use disorder, individuals with untreated anxiety or depression, and the people who seek natural alternatives to prescription medication. Because kratom is marketed as herbal and legal, people underestimate the risks and think that it's going to be perfectly safe, even though it's not FDA tested for those measures and doesn't have like a regulated amount that's safe to take. So it has some short-term effects at low doses. Those short-term effects include mild stimulation, a sense of well-being, and increased alertness. At moderate doses, they typically experience pain relief and relaxation. At higher doses, however, it gives the sedation, slow reduction time, dizziness, and nausea can occur. Long-term effects of use of kratom can lead to physical dependence and withdrawal that's very similar to opiate withdrawal. Where I worked, it was very similar, and some of them would even say it was worse than opioids, just because it's not studied as much, and so different insurances won't cover kratom withdrawal because it's not something that there is enough studies about. But individuals can experience cravings, irritability, anxiety, sweating, insomnia, tremors, and GI discomfort. Chronic use has been associated with weight loss and in some cases liver injury. Signs of abuse would be constricted pupils, sweating, frequent nausea or constipation, difficulty cutting back use, and withdrawal symptoms when attempting to stop. Patients often describe needing increasing amounts to achieve the same effect, no different than any other opioid. So kratom overdose risks increase significantly when it is used with other central nervous system depressants such as opioids, benzos, or alcohol. In high doses, respiratory distress can occur. There's been also documented cases of kratom being used specifically in suicide attempts with those with depression. Treatment focuses first on managing withdrawal symptoms, use of clonidine to reduce anxiety, sweating, and restlessness, anti-nausea medications like Phenergan or Zofran, anti-diarrheal medications like Imodium can be helpful as well. For patients with severe dependence, you could even use Suboxone to treat those withdrawal symptoms. Outside of that, there's non-pharmacological treatment that's really no different than any other kind of substance abuse. Things like CBT therapy, motivational interviewing to address those emotional triggers and build coping skills. Peer recovery programs, AA, NA, 12-step groups can help support long-term recovery. What is essential here is patient education. Many people think that it's safe because it's natural and legal in most states. They can see it being sold in gas stations and vape shops. It's important to explain the risk of dependence, withdrawal, and overdose, especially mixed with other substances. If a patient chooses to taper, a gradual reduction is safer than abruptly stopping. Because it is still considered new in the U.S. When speaking about substance use to young adults and teenagers, kratom needs to be in that discussion so they know what they're up against. So patients may need some additional psychiatry, substance abuse counseling, and recovery programs. Follow-up appointments should be used to monitor withdrawal symptoms, mood stability, and any relapse triggers. Relapse prevention planning is critical. In summary, kratom is a psychoactive substance with both stimulant and opioid-like effects. Its use is increasing, particularly among individuals seeking pain relief or a natural alternative to medications. However, it carries risk including dependence, withdrawal, and overdose. Awareness and appropriate treatment approaches are essential for safe clinical practice. Thank you guys so much for listening. I hope you enjoyed or learned something new, and I can't wait to see all of y'all's presentations as well. Thanks.